Hello and welcome to In Touch with Durham County. I'm Deborah Craig Ray, General Manager of Strategic Planning and Innovation. Joining me is our co-host and Chair of the Board of County Commissioners, Wendy Jacobs.
Thanks, Deborah. We use our show to share vital information about the exciting programs and services provided by Durham County government and our partners.
Emergency medical services is one of the critical first responder services that we count on. Joining us today is Captain Kathy Malone, Manager EMS, HR, and Public Information Officer, who will talk about the role of emergency medical services professionals in our community. Durham County is very fortunate to have a local Veteran Services office that is directed by Lois Harvin Raven, who is herself a veteran. She and staff member Lindsay Atkins join us to talk about services available to our veterans and the upcoming Veterans Day observance. Chairman Jacobs, let's begin our conversation.
Thank you, Deborah. And welcome, Kathy. Thank you so much for being with us here today. Could you just start off and just tell us a little bit about your background and what your role is in EMS?
So I am a 27-year veteran of Durham EMS. I've worked here since I graduated from college and have been a paramedic and have been in the agency in the education department. I'm currently serving as the human resources manager within our department, the hiring official, and I'm also the public information officer. So I spend a lot of time doing public events and out talking and talking about EMS, and I do live here in Durham, so it's very close to my heart.
And you serve many different roles then,
I
Kathy.
do. I have
many different hats.
Yes, I do.
Well, great. And can you first start off by telling us what is a paramedic?
So paramedics within the community are people that we all know, but they are people who are specially trained, have specialized training to provide care to when people are sick, when they're injured, when maybe they're having a mental health crisis. And the whole goal is to provide the care on an advanced life support level or a basic life support level to stabilize them or to treat them before we actually get them to the hospital.
All right, so we know how critical paramedics are. We've each had our own experiences with our family members or friends. Can you tell us when is it appropriate to call 911, to call for a paramedic for EMS?
So when you're activating 911, you can activate at any time. If you're unsure, you can call 911. When you're activating for an ambulance, it's usually for some sort of life-threatening injury or illness. If you're calling us because you have a cold, which people do, that's probably not the best use of our resources, and that you may be better calling your personal physician or maybe an urgent care. They may be able to provide you better care than what we can. So anytime that you feel like you need assistance, you can always call. We can always come out and look at you and maybe help you make that right decision on where you need to go or what you need to do.
Right, thank you.
Well, Kathy, of course, we're a large and growing community. Give us a sense of how many calls you all have to respond to in our community.
Historically, Durham County EMS will get one dispatch per 14 minutes. That's about the average. So that averages out to between 120 to 130 dispatches per day, or if you look at it on a monthly basis, it's about 4,000. And in 2016, we were dispatched a little bit over 46,000 times.
Oh my goodness!
So it's busy. It's a busy.
It's
busy.
Yeah.
It's a busy system.
Yes. So what is bystander CPR? I recall that our office actually got some training a couple of years ago.
So bystander CPR is cardiopulmonary resuscitation that is done by a layperson or somebody who is not affiliated with any kind of medical or life-saving organization or group. And essentially, 90% of heart attacks that occur outside of the hospital can be fatal. So knowing CPR or bystander CPR is actually a very important part of the chain of survival. So essentially what the CPR is learning to push hard and fast on somebody's chest, about 2 inches deep, and the song that you can kind of listen to in your mind while you're doing compressions is "Staying Alive" by the Bee Gees, and the actual rhythm or beat of the song is the amount of beats that need to be pushed in order to help that person.
Yeah. So now, will I get in trouble if I attempt that on someone? I mean, can I be sued?
Well, of course, anybody can be sued, but there is legislation in North Carolina that helps protect laypersons from, doing these types of activities of, helping somebody in attempt to help somebody. So most people are safe in doing that. We would prefer that you try to help somebody, help your fellow citizen or family member, versus worried about being sued, because layperson CPR really does save lives.
Very good. Now, I know in some cases when the 911 call goes out, we would have a fire truck respond before you can get your unit there. Tell us about that.
So people say, well, I called 911. Why, for an ambulance, why do I have a fire truck? So we work very, very closely with our first responders within the community, and Durham Fire Rescue and also Durham Fire Department have people on their ambulances that are credentialed EMTs, EMT or AEMTs, which are also intermediates, and paramedics. And there are more fire trucks and fire stations within the county and the city than there are ambulances that are, and they're more strategically placed. So when you call, if you get a first responder, you're getting care much quicker and faster than if you were just to rely on an ambulance coming from somewhere else. They're all part of the Durham County Emergency Medical Services system. They're part of our system.
Right, very good.
Yeah, and I think that's a really important point because, the first responders can play a very important role and help stabilize people until the EMS can get to them for the transport portion.
Correct. That is correct. And and we train with them, and they are trained to the same exact standards that our staff is. The only difference is that they can't transport a patient where we can transport a patient, but you're in good hands with everybody.
Right. And how can somebody become a paramedic?
So becoming a paramedic has a few steps to it. The first step is becoming an EMT or an emergency medical technician. That is the lowest level of training. And local community colleges provide that training, and here within Durham County, Durham Tech provides that training. Once you receive that credential, which it takes about 4 to 5 months to complete the course, then you would go into paramedic training, which can take up to an additional year to get that certification. Paramedics learn very specific, very difficult skills and lots of medications, and they learned a lot of different things. So making sure that they're competent takes a little bit of time. So.
And Kathy, I would love for you to also talk about City of Medicine, which has an EMT program.
Yeah, City of Medicine, and we actually work very closely to help get that program running, is that City of Medicine has their own EMT class as an elective for the students to take. And
we should mention that's a Durham public school.
That is a Durham public school, and the nice thing is that because we have worked very closely with them, some of their students, we've been actually able to offer them employment after where they come and they work with us as an EMT for a period of time. And then if they want to go to paramedic school, they go to paramedic school. We currently have a City of Medicine Academy graduate that is actually now working as a paramedic with us. So, she made it.
That's awesome.
Yes,
that's really great. How much? So when you call, for EMS to come and you need an ambulance, will that be covered by your insurance?
So the thing with insurances is we all struggle with insurances, is that we do file your insurance as a courtesy, but to find out what will be covered is all based on your policy, whether it is a full coverage, a partial coverage. So the best thing to do is be in contact with your insurance company as soon as you can to help cover the charges for the cost of the service.
Well, how much can somebody expect that would cost?
So it's not free, of course. We all wish it was, but you can't do that. So the basic cost runs between $400 to $800, depending on the level of service that you require. So it depends on what you have going on.
Yeah.
Yeah. So I can imagine doing this work is very stressful. How are your people affected by this work?
So, unfortunately, you think about the recent things that have happened in Las Vegas and in Orlando, and even the hurricanes that have hit. The stress, there's a high stress factor that comes along with this job, and it's really learning to balance life and learning to balance family and work, and it's not difficult, it's not an easy thing to do. It's a difficult thing to kind of manage, and basically we all watch out for each other. You have to watch out for each other, and some people manage differently, whether it's that we do some resiliency training with our folks. We stress exercise and finding family, finding things to do that are good stress relievers for them. But it does take a toll on people. You see things, you can't unremember things. So, but we're very aware of that, and we try to do the best for our people and make sure that they're well taken care of.
Yeah.
So I know part of the work you do involves education.
Yes.
Is it possible for like a community group to get you all to come out and
Yes.
maybe bring one of the vehicles?
Yes, that is probably one of my favorite things to do, and I've been doing it for a long time, is getting out into the public and doing activities with churches, health fairs, just anything to really promote health, wellness, and what we do. So if people want to call our main number, which is area code 919-560-8285, we can set you up with somebody. You just let us know the date, the time, the location, and how many people you hope to have at your event, and what their ages are. Because if it's a health fair for senior adults, I'm not going to be taking my kids' toys. I can, but we'd like to be able to have the right information for everybody.
Right.
Well, excellent. I'm sure the community would love to have you, and they can go out on our county website and
Yes.
get a little more information
Right.
about how to get in touch with you.
Right.
So again, we want to thank you so much for what you do and give our best to the whole crew.
I will, and thank you for having us on here today. So
Thank
we
you.
appreciate it.
Yeah. So at this time, we'll take a quick break. When we return, we'll hear about Durham County Veteran Services. Please stay with us.
I'm only 17, but I know about investing. Believe in something, buy shares in it, watch it grow. So, what if you could invest in the future? The future of kids, like a stock. Not the kind of stock that's about making money, but a stock for social change. A whole new kind of investment called Better Futures. When you invest, it helps kids go to college. I could be one of the first college graduates from my family, the first philanthropist from my neighborhood. And if I'm the first, then maybe there's a second and a third. Believe in us, invest in us, watch us grow. My name is Sydney, and I'm your dividend.
Welcome back. Lois Harvin Raven and Lindsay Atkins of Durham County Veteran Services join us for this segment. Commissioner Jacobs, let's continue our show.
Well, thank you, Deborah, and thank you, Lois and Lindsay, for being with us here today. Can you tell us a little bit about, the Durham County Veterans Affairs Department? Where are you located, and who's in your office, and what kind of things do you do every day?
Okay. So thank you, Commissioner Jacobs. So Durham County Veteran Services primary role is to provide comprehensive benefit planning for our veterans and to help them with the preparation of their claims and submitting those claims to the Department of Veterans Affairs in order to obtain, retain, and maintain benefits through the Department of Veterans Affairs. In our office, we have myself as director, Lindsay Atkins here, and Jonathan Crooms, and of course, Tina Ewan. Lindsay and I both are accredited representatives. We're authorized to represent each veterans before the Department of Veterans Affairs. That is a legal action. Jonathan just recently joined us, and Jonathan is an amazing young man. He will be actually doing his accreditation next week. We're going to be off to a conference. Jonathan is he's our outreach coordinator. And of course, we're located at 415 East Main Street on the first floor. Our phone number is 919-560-8387. And we are an advocate. We network and we advocate on behalf of veterans. And as a result of that advocacy, Durham County veterans bring in about $220 million in benefits. Of that, $71 million is in cash benefits directly through compensation and benefit plan. $1.5 million of that is through insurance and what we call DIC, dependent indemnity compensation. That's a benefit that is afforded surviving spouse after the death of a veteran. In addition, we have about $230-some million for health care benefits. So we're working very diligently to ensure that our veterans are aware of the benefits that's afforded them. And so that's kind of what we do on a daily basis, trying to make sure that we reach our veterans.
Wow, well, those numbers are very impressive. The service that you are providing to people in the community and the benefits that people are receiving as a result of that. So thank you so much.
Thank you.
How many veterans do we have in Durham County?
We're currently serving over a little over 15,000 veterans here in Durham, and last year we saw about 21,000. I wish we did. 2,100 veterans that we served last year through our office, and for a staff of 2.5, that's pretty good in terms of VSOs. That's pretty good for two folks.
Right. Now, you've mentioned a lot of different programs and services. What is the difference between compensation and pension, and how do people go about applying for these programs?
Well, that's a very good question. Really, we have two main types of compensation. One is called disability compensation, which is really based on a service-connected disability. This is something that happened to a military service member while they were in the military or in active duty status. It could have been cause or aggravated. And there's something called presumption as well, because, for example, our Vietnam veteran that actually served in Vietnam, exposed to Agent Orange, certain illnesses are presumed to be associated with Agent Orange. So that's our service-connected disability. The other one is the pension, which is called non-service-connected disability. For veterans, based on need, age at least 65, or disabled veteran who has served at least one day during a wartime period, at least 90 days on active duty, but one of those days have to have been due to a wartime period. Yeah.
Wow.
Now, are they also, well, I'm sure there are benefits for surviving spouses and, of course, their dependent children?
Absolutely. And the surviving spouses, really, it is kind of connected to whether or not a veteran was service-connected based on a disability and or the non-service-connected pension. So a surviving spouse, if the veteran was service-connected and died because of a service-connected disability, Lewis mentioned the dependency indemnity compensation. So a surviving spouse, and this is tax-free money, could get this monthly compensation based on that. The other one is, again, if he's a wartime veteran, it's called the death pension or widow's pension. The surviving spouse can apply for that. It is need-based. There's a special compensation for either housebound or aid in attendance. And it's also available for dependents, under 18 or a severely disabled child, a helpless child that was disabled prior to that age could also apply later on after that veteran has deceased.
Mm-hmm. Now, I think you mentioned earlier your new person that's in your Outreach Veteran Services Officer. Tell us what they're doing for you. I believe it's Jonathan?
Yes, of course, it's Jonathan Crooms, and we sort of stole Jonathan Crooms from one of our partners in the community. He was working with Volunteers of America as a homeless coordinator, case manager. So I had known Jonathan. Didn't necessarily say I was going to hire Jonathan, but he came in and he did an amazing job. So Jonathan comes in with experience in working with our targeted population. So we were looking to figure out where we were falling short. And we recognized that we were not reaching our age and disabled population and our rural veterans. So we needed to do a better job of doing that. We can't do it sitting behind our desk. So, of course, we went to the commissioners, our county manager and the commissioners, and we're truly grateful for that, Commissioner Jacobs, for you guys endorsing that. And so Jonathan came on board, and Jonathan's going to be in the community doing outreach, trying to reach those hard-to-reach veterans and surviving spouses. He's also going to be working with our dependents of our veterans who are potentially eligible for educational benefit. That is an untapped resources that we want to make sure the dependents of our veterans are accessing that benefit as well. So we're going to have him doing an array of things. We want to educate them about burial benefits that oftentimes go unused, and also utilizing our state cemetery. Now, we're not trying to kill off any of our veterans,
Right.
but when they pass away, we're facing those surviving spouses. And we want to make sure that they maximize their dollars that they now have left behind, because they're losing a great deal of that income. So we want them to have every opportunity to utilize those benefits. So we want to make sure Jonathan is reaching out to them in order to do those kind of benefits that we find that we have not tapped as of yet.
So it sounds like he's going to be out in the community a great deal. Yeah. So what kind of marketing will he be doing?
So we're hoping to move him into, shouldn't be speaking before we solidify this, but the Durham Senior Center, we're hoping to get him placed in at least once, if not twice a week. And then we're looking to hope that we become the first county in the state that has a mobile veteran service officer on wheels. So we want to go to them. So we're hoping to get a vehicle so we can be out in the community. And so that's our goal. So that's how we want to utilize and maximize that resource that we've been afforded.
Very good.
So bringing the services directly to the people who need it. That's a great vision. So I understand there's a great increase in the number of veterans and spouses interested in applying for the VA's Comprehensive Assistance for Family Caregiver program. Can you tell us about what that program is and how people can apply for that program?
So, thank you. So we've seen an influx number of folks calling about wanting to apply or coming to the office, and I was told that I was eligible for this particular benefit. And the bottom line, the basic criteria is if the veteran did not serve after 9/11, then they're not eligible for that particular program. And that program, for those who served after 9/11, they have a serious brain injury or a serious physical injury, and they're expected to be disabled for 6 months or more, that they need assistance with daily living, then they might be potentially eligible for it. But if they're not a 9/11 veteran, meaning anyone after 9/11 moving forward, then they're not going to be eligible for that program. However, we can perhaps steer them toward another program, which we call pension in need of aid and attendance. That's not a person, that is a financial benefit that can help defray the cost for a veteran who may need assistance with daily living, or a surviving spouse who also may need assistance with daily living.
Okay. So that's an important distinction between those programs. But this is exactly why we have this department, so that people can come in and learn about the differences and understand what they're eligible for. What about life insurance and burial benefits? Can you tell us a little bit more about those programs and what you might be able to help people with?
Sure, and let me say also that the services we provide are at no cost to our veterans or their family members, and we want to make sure that they understand that. The life insurance program, we feel is sometimes underutilized. We want to make sure that the family members know that the veteran has taken out this life insurance. It's called the Service Disabled Veterans Insurance. When a veteran is service connected, they have 2 years from that newly rated condition to apply. It's a $10,000 policy, so it is, there's a premium associated with it, but it's there for that veteran. And after 2 years, unless they're rated for a new condition, that clock kind of expires. Something interesting for a 100% service-connected veteran, they could actually get that $10,000 premium waived and apply for $30,000. We want the family members to know about it, the veteran to know. So sometimes they get the award and they're so happy to finally be awarded compensation that they don't read further down to apply for that insurance. So it's there for those the family members of those veterans, because as Lois has already stated, it's so disheartening when we get the call the veteran has passed and they don't have the financial resources available to have that decent burial. We have the state cemeteries for veterans as well as the national. These are resources we want to make sure our families know about. And that's one thing I think our office does very well. We try to educate the veteran and the family members of the veteran so they'll know what's available in terms of burial benefits. Some misconceptions out there about what's available for burial, but there are lots of benefits.
And how about educational benefits?
And this is going to have to be our last question.
Right, for the
Quickly.
children, for the families.
Yeah, and again, for the children, for the family, 100% service-connected veteran. The families do have educational benefits. North Carolina has a wonderful scholarship program for children of wartime veterans who are disabled. I think I don't know if we had time to talk about our Veterans Day program. I know we're running out of time.
Yeah, so let's just give the date and time.
Okay.
So our Veterans Day program is scheduled this year for November the 9th, and that's on a Thursday. It will be from 11 a.m. to 1 p.m., and we hope the community will come out and join us along with our veterans.
And we will make sure that we put that information on the screen so people can
Absolutely.
see it. But we really want to thank you all so much for joining us today, and we thank you for all you do.
Thank you both.
Yeah,
Yes,
thank you. Thank you.
Chairman Jacobs, we've had a wonderful show.
Absolutely, and I look forward to whatever we talk about next, our wonderful programs that we have like EMS and veteran services for Durham County residents.
Well, we want to thank you so much, and we urge you to please stay in touch with Durham County for all of the information that you need to know. Cheers.